Hi, everybody. Good afternoon, and welcome to the webinar on consults to care plans for oncologists. We're going to be talking about a few key topics today. How to use Empathia AI to pre-chart, how to customize your notes using templates. A lot of times, physicians would like to add additional information after the conversation with the patient is complete, so we'll take a look at that. And we also have a few questions from the audience, like Telemed on web and customization to train the AI. So we'll be going over that in during this session today. So if you haven't had a chance to try it out yet, this is what the web portal for Empathia looks like. We also have the Chrome extension. And the app is available on the phone. So the Chrome extension is usually preferred by physicians who like to use it alongside their web EMR, so that it's easy to review information in the EMR and kind of use the Chrome extension side by side. If that's not what you're comfortable with, you're always welcome to just continue using the web platform. And the main action that you perform is click on this blue button to start recording a new encounter. And I know that this recording model might look a little bit overwhelming, but the first thing that you need to do is just focus on the blue button to start recording a patient encounter. So once you click on start recording, you can have a normal patient conversation. The AI will listen in and filter out any non-relevant information and use the medical information that was discussed to generate the final note. You have the option to create SOAP notes, consult letters, and additional letters from the same recording. You don't need to take any additional actions. What you see applied here is a template. A template basically provides structure to the note. These are instructions to the AI as to how you want your note to be organized, which sections you want to include, what information needs to be included in which sections. That's all defined within the template. And it helps to make your note appear more in your style than just a standard SOAP note. So let's take a look at a sample note that I've created on my account using an oncology template. It includes the diagnosis, the history of present illness, medications, any social and family history, the plan that was discussed with the patient, and the next follow-up actions. So as you can see, you can define the sections and the AI will capture information as discussed in the encounter. I see there's a question. Can I make a patient encounter without starting a recording? Yes, absolutely. So I think you're referring to getting a draft ready and then recording on your mobile, if I'm not mistaken. So what you could do is you can get that set up by typing in the patient's name here. If you want to add any context to the visit, like patient's age or most recent labs or anything like that, you can copy paste that information from your EMR and you could generate a draft summary. So what this would look like is something like this, a draft note, a sample note, and it will include any key information that you have captured. So you haven't done any recording and you have generated this draft. And when you're ready, you can open your app. You will see this microphone button right next to the draft, and you can start recording on this draft note. There is another way to create a note, like a complete entire note, either a SOAP or a consult letter without any patient recording. So in the situation that for whatever reason the patient did not consent to the conversation or the patient is not able to have a conversation, a critically ill patient or something like that, there is an option to type or dictate all of your findings directly into this text box here. you can upload relevant documents, and you click on this little up arrow right next to the start recording, and you save without recording. So when you save without recording, it will generate either a SOAP or a consult, depending on your preference. And you will see this final same output. So there are two options, like we talked about. One is to generate a draft, and one is to save without recording. Does that answer? I hope that answers your question.
Yes, it does.
Okay, awesome. All right. So we were,
Sorry, I had one additional question.
yes.
So when I hit the dictate button,
Mhm.
will it show my dictation as I speak it, or will it record the in entirety and then analyze it and then have the output?
So yes, the dictation will record it in entirety. It's a little bit of a different experience than the standard FESR that health authorities have. So it will capture it verbatim. It will insert all the exact words that you have dictated, but it just doesn't show it in real time.
Okay, thank you.
So were you referring to this dictate button or?
Yeah, I was just wondering if there's any sort of direct dictation where I can see it as I'm speaking it, but so you're saying it records the entire dictation and then so it doesn't alter it, but it'll the output will be the entire dictation.
Yes. So this microphone that I showed here, this is part of this text box, like the visit context. So I would use this, say, if I'm looking at my EMR and I'm just looking at some lab values and I'm saying I'm only interested in the RBCs were such and such, the iron level was such and such, and I don't want to copy paste the whole lab result or something like that. And I can just dictate it and it will capture it as is. There is another option of record a dictation over here, and this is for your entire note. So this record dictation again can either just take your dictated information and spit it out as is, or you can choose for it to be formatted into the template that you have selected. That makes sense. There's
Perfect. Thank
there's
you.
a lot of different variations depending on what you're looking to do. So some physicians, they just use record dictation and they dictate their entire note, like complete with the full stop, next paragraph, next line, and things like that. It's not required. They're doing it out of habit. You could just simply record dictation and say that I saw a patient, such and such name of this age. This was my examination results. This is my assessment, and this is my plan. And it will organize it into this consultation template that you have selected. So that's the difference between the verbatim and the formatted dictation.
Okay, thank you.
And the same functionality exists on the app as well. So there is, when you're going to click on recording, there'll be an up arrow on the app from which you can access the record dictation functionality. Um, okay, so we looked at the note. I knew one of your questions was how to modify the note really quick and train the AI. So the little purple wand that's available on every note, that's the smart edit, and that's what we use to train the AI. Excuse me. So this can be used for any quick changes that you want done to the note. So like maybe for one specific note, you are noticing that there is a long social history and it is cumbersome to read it in a paragraph form. So you can say change social history to point to a bullet style list. And what that will do is edit the social history if there are multiple things that are included there. As you can see here, it has changed the paragraph form to a bulleted list. And if you're happy with the output, you can insert it into the final note. Other common instructions that people use for smart edit are maybe at the end of the note, you want some kind of a AI disclaimer, or you want a signature to be added. There's some formatting that you would like to change. You want the headers to be in bold or something different. You can always use Smart Edit for those quick formatting changes or styling changes to the note. Like I mentioned earlier, the template does a better job of structural changes. So say, for example, it is capturing some social history in the HPI section as well, and you don't want the duplication. Then you would go back to the template and mention avoid duplication of information, or make sure that there is a separate section for substance use or something like that. So that's the difference between how you can, which tools to use to train the AI, whether you use Smart Edit. So that is the main way of training the AI for all your future notes, for your style. And the template is more for the structure of the note. I'm just going to pause for a quick second to see if you have any questions before I go forward. Okay. I'm just going to quickly get into templates because we've been talking about it quite a bit. We have templates in the community folder that are filtered based on your specialty. So whenever you sign up and you select your specialty, based on that, you will see a filtered list of templates. You are always welcome to browse the community for all the different templates. Maybe there is a surgical oncology template that is more um, suited to what you're looking for than specifically in the oncology section. So always feel free to browse the community, and you can take a look at the contents. What I find is that a lot of physicians may find the creating a template from start to be a little bit intimidating. So this is a good place to start. You can review it, you can import it to your personal folder, and then add or modify it a little bit as you prefer. If you do not want to spend the time in the community library to look at all the different options available, the easiest way is to create a new template. And you can do that either by uploading a sample note or an existing template from your EMR or another AI Scribe platform, or you can just copy paste it as free text into this text box. What I always like to remind people is to select the type of the note that you're creating. For oncologists, we have often seen that consult letter is the type of note that you're most commonly using. So make sure to select that note type. And let's take a look at the difference between what a consult letter and a SOAP note looks like. So the template for a consult letter is just in a letter style. It's just a series of instructions with placeholders for what information needs to be included. And that's very similar to the inputted information. However, if you go to the SOAP note, um, let me see, oncology, we have a SOAP note in the community, I believe. There we go. So the SOAP note has different sections. It's not a letter style format. It will have the separate sections. Um, it's probably similar to the flow of the consult letter. The key difference is the way the SOAP note is structured is it tries to organize it into the 4 different SOAP sections. So if that's the format that you prefer, then the SOAP note would be the way to go. So that's a little bit on how to create a template for yourself. Once you have created a few templates, you can set it as default using this toggle button. So what that does is anytime that you are starting a new encounter, it will Didn't apply right now. Let's try that again. There you go. So whenever you start a new encounter, the default template that you have selected will be applied here. So you don't have to select it every time. Um, if you have a template for different notes, say you want a patient handout generated every time that you meet a patient, and you've created a template for that, you can apply different types of templates at the same time. So once your recording is complete, it will auto generate a consult letter, a patient handout, maybe a referral letter if that's what you're looking for, all with the templates that you have already applied. So that's the advantage of this template functionality here. Okay, let's take a look at. So I quickly mentioned generating patient handouts and referral letters. If you have not set a template or created one, that's not a problem. You can use the default templates in Empathia to generate these kind of notes. As you can see here, the patient handout can be generated in multiple different languages. So it's easy for the patient to review the follow-up instructions or the next steps as relevant. And the referral letter here, again, you have the option to select a template if you have created one. If not, Empathia will just use the existing default to generate a referral letter. You do not have to spell out who the referral letter needs to be made to. It captures directly from the conversation. Say you were mentioning to the patient that I'm going to send you back to the family physician for certain medication changes, or I want you to check in with a surgeon for some other follow up. It will capture it directly and create those target referral letters. So this is the two that were reviewed in this conversation, in the sample conversation. So that's why it generated a plain clinic referral and a palliative care referral letter. Um, a quick functionality that I wanted to highlight also is the supplementary note. A supplementary note is a very flexible type of a note that is available on Empathia. And what that does is it allows you to generate whether it is an interdisciplinary clinic meeting that you had, or you want to create a medical justification letter, or some kind of a disability letter, or any additional documentation that you need to create for a patient from a given encounter. You just have to click on the generate other notes supplementary note and apply the template what you're looking for. So let's say, for example, I'm trying to create some kind of a note for this person to take to their workplace and say that they're not available to come into work for a while, then I could create a sick note. Very often, the interdisciplinary clinic meetings would be relevant, especially for the oncologist workflow. Sometimes the AI will state that the patient doesn't endorse smoking history. What kind of direction can I give so only things discussed are included in my template? That's a good question. So the question was how to make sure the template follows the instruction not to include negative information. So there is a section at the top here, like instruction for the entire note. You can type in here, include only relevant positives reviewed in the encounter transcript. Um, and you can give it an example like do not include negative statements like no, what was that? No smoking history endorsed. So that would be a way to kind of instruct it from the template level. You could also do it from the smart edit. After the note is generated, you could go into the note and use smart edit here to specifically remove the section or negative statements that appear. I find that doing it from the templates is much better, so it's not happening after the fact of the error has occurred. Okay. I hope that answered the question. And I know we're kind of running close to the time, so I'll keep going. We talked about, okay, let's quickly take a look at how to add additional information after the note is complete. So we've received a lot of feedback saying that I spoke to this patient and everything is done, but I just wanted to add a quick note after the patient left, which I forgot about. You can do it directly from the note level by adding a recording. You can add to the visit context if it's like reports or test results that you're looking to add, or you can just click on the start recording button to capture any additional information. So the use case for this additional recording can also be maybe you created a note by talking to the patient. There is some family members that you want to speak to gather more relevant information, or you're providing education to the family members and you want to make sure that that is captured as part of the encounter. So you can also use this microphone button here, right from the encounter level to click add more information after the encounter is complete. I'm quickly going to go jump into Telemed. So you see this Telemed option here. It's allows you to call directly from Empathia's web portal. You can just type in the patient's phone number, whatever it is, and click on call, and that will start the phone call. You click on the encounter button to pull up this patient information, and similar to the workflow on the web, you can add information to the text box here. You can add the patient pronoun, add a template, and so on and so forth. So what this does is it allows you to generate a note directly from your phone call without having to use two different platforms. And this works well both for a speaker and also using your headsets. We also have the ability to record from another platform. So if you are comfortable already using Zoom or Doximity or any other virtual telehealth platforms, then you can use this share screen functionality to record from the other platforms. So similarly, it will create a note at the end of your conversation. So that's the Telemed on web. Forgot to mention there's an option to set your caller ID. So what this does is you can use your clinic number to set as your, excuse me, caller ID. And so that when the patient receives the call, it's a known number. It increases the call pickup rates and also gives the option for the patient to call back your clinic in case the patient was not able to answer your phone at the time that you called. So that's the caller ID functionality. Let me quickly go back to my list. We talked about generating referral letters, patient handouts. I wanted to just mention quickly the multiple speaker option. For users who are using the Chrome extension, we have an additional functionality to capture multiple speakers. And I find that is relevant, especially for oncologists who may have consultations with not just the patient, but different family members or other clinicians present during the conversation. And the best way to use this multiple speaker recording is when you start the recording, you can either address as to who is present in the room. For example, today I'll be speaking to the patient whose name is such and such. Patient is present along with his family members, and also present is surgical consultant as part of the conversation. And then you can have your conversation as useful. It's just helpful for the AI to know who is present in the conversation so that it organizes the final note a little bit better. So yes, that's the multiple speaker recording option on the Chrome extension. I'll pause really quick here to see if there are any questions or if I have missed answering any question that was posed earlier. And I'm going to stop sharing for just a quick second. Okay. All right. And I'll share one again. So before I conclude the conversation for today, I know that there was a lot of information that was shared. The key is for any physician to just start recording encounters. And as you continue with the process, you will realize you have some questions or you need to modify certain things. You can always reach out to us directly using this little green button at the bottom. That's our live chat. You can either chat with our product specialists or you can schedule a one-on-one Zoom call to customize the platform to your workflow. Yeah, and there is always this little getting started waving hand up here, which also has additional resources like this onboarding guide, which includes a lot of videos on how to either do the basic steps or how to customize and other different use cases. So I highly encourage you to take a look at all these different resources and reach out to us directly if you have any specific questions. Um, any other questions that would be helpful for your daily workflow?
No, none for me.
Okay. All right. Well, then, thank you so much for taking the time this afternoon to attend the webinar. I hope I was able to answer your questions and you found the presentation relevant to your practice. And yes, feel free to reach out. We have a few more weeks remaining in the BC Scribe trial, so we're looking forward to hear from you. Thank you so much.
Okay. Thank you.
Thank
Bye.
you. Bye-bye.